Hello, I am Dr. Ted Barnett, President and founder of Rochester Lifestyle Medicine Institute, and I am so excited that people are joining us from all over the country tonight. We'll give people a few more minutes to pop in there. It's like popcorn popping. We're coming in pretty quick here. All right, great. Yeah, so once again, I'm Dr. Ted Barnett, President and founder of Rochester Lifestyle Medicine Institute. I'm really excited to be able to present this program tonight about the evolution of lifestyle telemedicine with Kim Scheuer, Dr. Kim Scheuer, and Anthony Masiello, the founder of Plant Based TeleHealth, which now has a new name, which I'll tell you about in a minute. So the people giving the lecture tonight, I'm very excited to introduce Dr. Kim Scheuer, fellow physician. She's board certified in both family practice and lifestyle medicine and has practiced in primary care settings for over 20 years. Dr. Scheuer attended the University of Rochester School of Medicine in Rochester, right here, well, a little bit further north. I'm in the southern suburb here, and completed her residency in family practice at the Ventura County Medical Center in Ventura, California. She received her MS Education Specialist for the Deaf at the University of Rochester National Technical Institute for the Deaf and received her BA in biology at the University of Rochester. She started the online focused practice DOKS Lifestyle Medicine and also practices with Love.Life Telehealth, formerly Plant Based TeleHealth, and she is conversant in Spanish and American Sign Language, which she uses to bring her knowledge to multiple communities. So I'm very excited to welcome Dr. Scheuer. And Anthony Masiello is the co-founder and CEO of Love.Life Telehealth, formerly Plant Based TeleHealth, a national lifestyle telemedicine service focused on the prevention and reversal of disease and optimizing health and wellness with lifestyle medicine and whole food plant-based nutrition. Anthony has been working in healthcare for more than 25 years. His professional career started by doing bioinformatics for the Human Genome Project, later shifted into research and development at Novartis Pharmaceuticals, and 17 years after that, he personally transformed his own health and learned that there was a better way. He shifted his career once again and is now 100% focused on providing access to medical services centered on the prevention and reversal of disease, utilizing lifestyle medicine rooted in whole food plant-based nutrition. Anthony is on a mission to dramatically shift the healthcare focus from management to the prevention and reversal of chronic disease by enabling millions of people to implement lifestyle changes that will truly improve the quality of their lives. His personal health transformation has been featured on the Megyn Kelly Today Show, on PBS, in the Huffington Post, in the best-selling book Eat to Live, and by Forks Over Knives, Runner's World, and numerous magazines, websites, radio shows, podcasts, and articles. And so I'm so excited to turn this webinar over to Dr. Scheuer and Anthony Masiello, and I will stop sharing now and welcome the two of you. Thank you for joining us.
Thank you for having us. I'm super excited to be here.
Turn it over to you guys. You want to share your screen?
Great. Yes. Thank you for the introduction, Ted. Thank you so much for having us. You know, you guys have been incredible partners since we started Plant Based TeleHealth, and it's just so fun and exciting to just continue collaborating with you as we all kind of evolve and grow our programs and just try to help more people going forward. So thanks again for having us.
You're welcome. It's great to have you here.
I'm sharing my screen now. So is that working?
It looks good.
Dr. Scheuer and I are just going to introduce ourselves and kind of help everyone to have a little bit of an understanding on why we care and how we each independently came to caring about helping people in this way. And then we'll go on and share a little bit more about why we started a telehealth platform, providing lifestyle medicine services. And then we'll answer some common questions. And we do want to leave plenty of time for Q&A because we would love for anyone who's watching to really get the information that they're looking for. We tried to anticipate as much as we thought that people might be interested in, so we prepared that. But we're very happy to adjust and to make sure that we answer any specific questions. So I know there's a Q&A section. Just for the sake of kind of efficiency or streamlining here, just feel free to go ahead and put your questions in there as they come up. And then we will wait until the end and we'll reserve the last 15 or 20 minutes. We can just go through there and we can answer those questions. But if you just as you think of them, pop them in there. And I think that'll be the best way to handle it. So introducing myself. I mean, the short answer is this is why I care so much about lifestyle medicine and helping people have access to this kind of care. This is the old me. I grew up obese. This is me in 2005. By this time, I was 33 years old. I weighed 360 pounds. I had a 54-inch waist, and that's one thing. I was also on medication for high blood pressure. I had been diagnosed with high cholesterol, although I was in like the 220 range, and I was able to convince my doctor that I didn't need medication at that point. I don't know how. I had been diagnosed with sleep apnea. I had migraine headaches. I had psoriasis on the back of my neck. I had eczema on my fingers. And the real clicker for me, none of those conditions on their own really scared me individually, because I knew tons of people who were in similar situations. I had friends who were obese. I had friends with high blood pressure. I had friends with high cholesterol. I had friends with sleep apnea who were on CPAP machines. But the thing that really woke me up was being denied a 20-year term life insurance policy. And I went to apply for this policy because my wife was pregnant with our second son. And that was a huge wake-up call, because this combination of conditions, basically an insurance company plugged in my information into their algorithm to decide how to insure me. And it came back as what I would interpret as a bad bet, meaning that they didn't expect me to live for 20 years. And that, the most important thing that did is it forced me to take a really careful and objective look at what my life was really like. And when I did, I wasn't necessarily happy with what I found. I was, like I said, I was married. I had a career. I was fulfilled in some of those areas of life, but there were a lot of things that were really challenging. Some things physically, like the fact that even with a young child, I couldn't do simple things like take my kids on the amusement park rides when the carnival came to town. Or when I would board an airplane, it was kind of like if I was walking down the aisle of an airplane by myself, I felt like all eyes were on me. And waiting to see anyone with a empty seat next to them was a little bit nervous as I was approaching. And they seemed visibly relieved as I continued going. Not only was I 360 pounds, I'm also 6'4". I tend to take up a lot of space, and it causes challenges in life. And the physical is one thing, but the mental and emotional that came along with that was also somewhat exhausting. So I knew I had to do something, because this was now much more important than me. It was much more important than me physically. So I searched and searched and searched. I had tried to lose weight my entire life, but I was determined to do it again. I was already vegetarian. Back in 2005. I went vegetarian in 1994, so about 11 years before, and that helped me for a little while. And then I found all of the junk food, vegetarian foods that could help me to build up to a 360-pound person without happening to eat meat. So the weight loss programs that I could find at the time were all centered around high protein and those kind of programs. So I was searching for vegetarian weight loss, and funny enough, because he's your next lecturer, I came across Dr. Joel Fuhrman's book, Eat to Live. The cover of that book says the key to fast and sustained weight loss. And that was enough for me. That pulled me right in. But the real cincher for me was that I read the comments on Amazon and the reviews, and almost no one talked about weight loss. Everyone talked about getting healthy. And some people mentioned that weight loss was a side effect of becoming healthy. And here I am as this new dad and someone who's really excited about raising a family. And I realized at that point in time that I didn't really want to lose weight. What I really wanted to do was get healthy. And I was convinced that this lifestyle, the nutritarian diet, and this lifestyle that we all know about now, was it for me. So the short of the story is I bought Dr. Fuhrman's book, Eat to Live. I did exactly what it said. I made a ton of mistakes on the way, but I kept refining my process and getting better and better and better. And what that involved for me was eating more fruits and vegetables, some nuts and seeds, and plenty of beans, legumes, and a modest amount of whole grains. And it worked. I got healthy, and I lost a total of 160 pounds in just 20 months. I got off all my blood pressure medications in about 3 to 4 months. My doctor was amazed at what was happening. My doctor did not practice lifestyle medicine, but was very open to me doing whatever I could to take better care of myself. And she became really impressed with what I did. And the rest of the story kind of becomes history. I got to raise my children from near birth, well, from toddlers, exactly the way I would have wanted to. I got to be that active father that I wanted to be. You can see in some of the pictures here, we would go on hikes. I take them dirt bike riding. We go skiing and snowboarding together. I took back up skateboarding. We go canoeing. This bottom picture here is really important to me. That's when I came home from work one day and the kids were learning how to jump rope so they could participate in the Jump Rope for Heart program at school. And I wasn't the kind of dad who would pull up a chair and watch them. I actually got out, took off my work shirt, and then I'm standing there with them jumping rope on the driveway with them in my t-shirt. And little things like when we would play basketball, the ball would go running, like rolling off the driveway. I wouldn't just wait for them to go pick it up. I actually got to run after it with them and kind of try to race them to the ball. And we got to laugh and giggle and do all the things that we want. So I'm personally eternally grateful for what this diet and lifestyle has done for me. And as happens to many people, now I just am focused on helping other people to do the same for themselves with this information. I know it was a little bit long of an introduction, but now I'd like to pass it to Dr. Kim Scheuer so she can tell you about herself.
So I'm Dr. Kim Scheuer, and my story is I was a vegetarian for most of my life I started my life very, very thin. And when I hit puberty, I stopped growing up and started going out. And then when I went to college, I became a vegetarian, but I was a Milky Way vegetarian. I basically ate junk food, cheese, candy. I hadn't had a salad in my life. I became a physician and went to medical school and didn't learn anything about nutrition at all. Didn't learn anything about lifestyle. I learned how to give medicines and diagnose people and things like that. I started working at Aspen Medical Care, which was a traditional family practice, and gave people wrong advice and struggled with the weight all my life from the age of 13 until I was 47. At 47, I realized that my mother, who's pictured here, had had breast cancer at 48. And I was like, how do I prevent myself at 47 from having breast cancer next year, just like my mother? And my grandmother had colon cancer. There's a bunch of issues in the family. And I was like, what do I do to protect that? So at the same time as that happened, as I started questioning that, a friend of mine was going to nutrition school and asked me if I would do a 3-day food diary, which I did. I wrote a 3-day food diary, and I figured since I'm vegetarian, I'm healthier than most people in this country. And she came back and said, oh my God, you eat terribly. You eat horribly. You need to change your diet, and you need to eat vegetables and fruits. And I'm like, I can't do that. I don't like them. I don't know how to cook them. And at the same time, I read the China study and watched Forks Over Knives. And that changed my life because she offered to cook for me for a month. She made me a green smoothie that day. And I remember she was putting cucumber in there and kale in there. And I was like, I can't have that. It's going to taste terrible. I almost refused to have what she was giving me. She's like, no, you have to taste it. I tasted it and it was delicious. And I was like, oh, I can do this. So, I was a terrible cook. She cooked for me for a month. I had a smoothie every day for a month. She cooked for me. And after that month, I had lost weight, eating more than I'd ever eaten before. And I had done everything from Diet Center to Weight Watchers to starving myself to, I always thought, oh, if this was just like smoking or alcohol, I could just stop it, but I can't stop eating. And since I've gone into lifestyle medicine, I've changed my opinion on that because smokers need to breathe. They just don't need to breathe tobacco, and alcoholics need to drink water, but they don't need to drink alcohol. I need to eat, but I don't need to eat junk. So in a month, the weight poured off. My cholesterol plummeted. My energy went up. I would wake up at 5 o'clock in the morning before this to go to work and be like, oh, I can't do this. I don't want to. And it would be a struggle to get out of bed. Now I was waking up at 5 o'clock in the morning, like, let's go. Woohoo. And it was amazing. So it changed my life, and then it changed my patient's life. So you can see I don't have any slides like Anthony did on when I was heavier. I was 50 pounds heavier. I'm only 100 pounds now. So I was a third of I was heavy. I held it well, but I just don't have pictures of me like that. The next slide does show, though, how I am now. And I now live the lifestyle I prescribe to my patients. And lifestyle medicine is plant-based eating, getting rid of toxins. So, and for me, the toxin was not alcohol or tobacco, but the toxin was Milky Ways and all that stuff. I'm a food addict. There is no question about it. But now I have the time outdoors, the relationship, the purpose in my life. For example, changing my life from traditional family practice to joining plant-based telehealth, which I was so lucky to do, made a huge difference in my life. Learning about lifestyle medicine and all the pillars of activity, adequate sleep, stress reduction, all that has changed my life. And I love life now. And I love working to help other people do the same thing.
I'm actually surprised that you're sitting still for as long as you have so far.
You know what I'm doing?
Energy.
I'm actually doing soleus push-ups while we're talking. That's where you just push your toes down and you raise your heels. And that helps a lot for me to get my energy out.
You are a bundle of energy. So that's who we are. That's why we care. And now we want to tell you a little bit about why telehealth. So as Dr. Barnett mentioned, I was working in pharmaceutical research when I made this transformation. And I wanted to help other people as much as I can. So I did a lot of volunteering. And what that normally looked like was sharing my personal testimony, personal testimony with the hope of helping to inspire people to take action for themselves. But I wasn't satisfied with that. I wanted to do more. I didn't know exactly what to do. So I started listening and paying attention to where was contribution needed in this field. And I noticed a pattern. I would go to all of these conferences and these immersions, and I would go to all of these weekend getaways, and I would see the same thing happen every time. We would see an incredible physician who would talk about the science of nutrition and the other aspects of lifestyle medicine, like getting a good night's sleep, managing stress well, exercising, stopping harmful substances like cigarette smoke and these other things. And then they would show their own patients and the results that they were getting with them. And it was incredible. And we would see people who have healed from many of these chronic conditions that that the majority of people today are suffering with. And then they go to the Q&A session. And you have someone in the audience raises their hand. This is almost every single time. And they say, hello, my name is so-and-so. I'm also suffering from whatever condition is being spoken about. Where can I find a doctor who can help me? And there was never a good answer. There are incredible lifestyle medicine physicians that are in different pockets, I would say, around the country. I live in New Jersey, and we had several at the time. We had Dr. Furman, we have Dr. Stancic, we have Dr. Weiss, we have Dr. Chandler down by the Jersey Shore. So we had a few, but none of them were really easily accessible. And I think it was a little bit unusual to have that many. They all lived in areas that sometimes would take an hour or 2 hours to get to. And then I know that you have several in Rochester, New York, but what about the people who are in someplace like Kansas or in North Dakota or in a remote area in California, or even where I am, a remote area of New Jersey, right? So telemedicine seemed to be like a viable option to reach a lot of people to basically take down those geographic barriers. The other thing is, even the doctors I know who were practicing, they didn't have an overflow of patients in their local geographical areas. I also thought that telemedicine would help a single doctor, if the doctor got multiple licenses, to reach much more people and hopefully to have enough patients to build a viable practice. And that was enough. The fact that nothing like this existed at the time, this is back in 2019, and that I thought that it could be a significant contribution to the community of lifestyle medicine. So I basically, this was shortly after I had left Novartis, and I put all of my energy into this. I found I started working with a few incredible physicians to start, and we launched what was it took a little over a year and a half to get through all the regulatory hurdles and figure out all the legal and compliance issues with doing essentially a national medical service, and to contract with doctors and these corporate practice and medicine laws and all of these complications. But we finally launched in March of 2020, and everything was validated at that point in time. Previously I knew a bunch of doctors who wanted to see patients, and I knew a bunch of patients who said they wanted to see doctors. But I finally got the website up and running and ready to go on March 23rd. And I think before I went to sleep around midnight, I sent a post out on my social media, which I have a very small following. And I just explained what we had done. And then by the time I woke up in the morning, I had heard from about 20 patients who wanted to make appointments. And I heard from 22 doctors who wanted to practice on the platform. And that was like one of those light switch moments that said, this is it. This is what I need to put all of my energy into. And it's exactly what we're doing now. So we believe fundamentally that everyone should have access to a doctor who practices lifestyle medicine. Our next step now is helping people to want to have a doctor who practices lifestyle medicine. And that's 100% a shared mission that I know that we are all on together. We also know that we want people who already eat a whole food plant-based diet or are already vegan. We know that it's important for them to have a doctor who understands their lifestyle, who's not going to be asking them questions about where do you get your calcium, or where do you get your protein, or how are you going to do with this or that, and creating those sparks of doubt and basically confusion when someone's doctor says to do this, yet they read all the literature and books that tell them to do that. And third, I absolutely love my role, which is, I consider it a tremendous privilege to connect patients with wonderful healing physicians like Dr. Kim, the other doctors at Love.Life Telehealth, and many of you who are here. It's a privilege because I worked the phones for the first 2.5 years of plant-based telehealth, and just hearing people say, oh, you mean I can have an appointment tomorrow, or I can have an appointment next week? Like, people are so excited. And then we'll share a little bit later what the patients are actually saying about after they have their appointment. So it's a wonderful mission, and that's how it got started. That's why it got started, and that's where we are. That's what we're working towards now. I do want to mention, because we've said it a couple of times, our name has changed. We started as Plant Based TeleHealth, and we are now Love.Life Telehealth. And I could not be more proud of that. Love.Life is a company that is headed by John Mackey, the founder and former CEO of Whole Foods. This is his next iteration. This is what he's focused on doing, is bringing lifestyle medicine to patients in the world. Love.Life is going to be a much larger company. We're going to be the virtual arm of that, but all of that is going to unfold in time, and we'll learn about that as it happens. But for the short term, I do want everyone to know that the only difference is our name. We have the same doctors, the same mission, the same focus on a plant-forward, or plant-based lifestyle, and providing lifestyle medicine to patients everywhere. What the other good news is that in coming months, we will be able to offer additional services to patients in the forms of, kind of advanced medical assessments. And we can really help to go deeper, because now we have more resources behind us, and we have access to a larger network on the business side to be able to do more and to further promote this mission so that we can reach even more patients going forward. What is Love.Life Telehealth? What Love.Life Telehealth really is a collection of incredible physicians. I often call them healers, because that's what they work to do for their patients. They don't really work to treat their patients, although that is what they do, but they really help their patients to heal. So it's a national telemedicine service that's focused on optimizing wellness and the prevention and reversal when possible of disease, medical conditions, chronic disease, whatever patients may be challenged with, using lifestyle medicine that is rooted in whole food plant-based nutrition. And I wish I could have every one of the doctors here because they're all as special as possible, but I'm incredibly grateful to be talking about this today with Dr. Kim, which means I've spoken enough so far. So I am going to turn it over to Dr. Kim now, and she's going to talk a little bit more about the state of chronic disease and why this is necessary from a medical perspective.
Sure. So 80% of what I used to see in my traditional family practice was chronic diseases, obesity, hypertension, diabetes, depression, et cetera. And that's the majority of what I saw. And 80% of that is preventable with its lifestyle created. So it's reversible and preventable with lifestyle changes. What I love about being at Love.Life Telehealth versus being in my traditional family practice is, in the traditional family practice, patients would come in, they'd spend time signing up, seeing the nurse to get their vitals. And by the time I got to see them, I probably had 10 minutes with a patient. And here I get a full 30 minutes with every patient, and it's wonderful. And as you can see, we know that chronic diseases like eating well, being physically active, avoiding tobacco and excessive drinking, and getting regular screenings helps Americans improve and prevent chronic diseases. The other thing about being at a telehealth like what we are at is we can see patients in all the states and internationally, which is wonderful. So I've got over 20, I think I have 23 licenses now. So I can see people in many, many states. But if I don't have, and each one of the docs at Love.Life Telehealth now, we each have our strengths and it's nice because if somebody else has a strength that I don't have, but I'm in the state where the patient is, I've got a brain trust of physicians that's incredible. I can ask you don't just see me, you actually see everybody in our group when there's any problems or concerns, or, if there's anything I need extra help on to help my patients. So it's wonderful. So we make a huge difference, but I'll let Anthony talk about how this works. And I think I mentioned a little bit already.
Yes. Yeah. But wonderful. You mentioned that. So the shortest appointment that a patient can have is a full 30 minutes with the doctor. Patients also have the option of having a 60-minute appointment. The truth is it's better for everyone to have a 60-minute appointment. The doctors prefer it. The patients usually prefer it. They get much more out of it. However, and we will get a little bit more into this, since this is patients paying out of pocket, we don't want that to be a limiting factor. So there's no requirement to have a 60-minute first appointment. Every patient is welcome to have a 30-minute first appointment, or 30-minute first appointment and follow-up appointment. There's no requirement to have a longer appointment because we want the doctors to be there for everyone. The other thing I'll say is once an appointment is scheduled, the patient receives a series of questionnaires, and we have a really advanced lifestyle or intake questionnaire that includes all of the things like medical history, but it also then includes your current lifestyle. It includes your personal health and wellness goals, and it includes some behavioral questions about how ready are you to change. It includes a 3-day food diary, and the doctors make a tremendous investment in their patients before that first appointment because they review all of that before the call starts. So even when you're starting your 30 minutes, this is not quite a, hey, let's get to know each other. This is a more like, let's pick up from what I've learned so far. Let's ask some clarifying questions and let's get to work on helping you to achieve your goal. The appointments happen. We're trying to mimic as much as possible an in-person visit, but obviously doing that by telemedicine. So it is live, it is video and audio back and forth. So the physician and the patient can speak together. And we have a secure patient portal where the patients can upload prior lab results. They can upload other reports that they have. They can go over them together with the doctor. The doctors, when they see patients in the US in states that they're licensed, they're fully licensed medical appointments. That means that the doctor can order lab tests. We have national accounts with both Quest and LabCorp. And if prescription medication is required, then the scripts can be sent right to the patient's local pharmacy. And in most cases, by the time you get off your call with the doctor, drive to the pharmacy, it's there in a bag ready for you to be picked up. The difference in the licensed medical appointments for patients in the US and international appointments is the international visits are not, they're lifestyle medicine consultations. And what that means is we're not plugged into any international systems for medications or for lab testing. So we unfortunately can't, or the doctors can't unfortunately order that for you. But what they oftentimes do is they make suggestions or write up recommendations that then patients in those countries can take to their local doctor. They can have a much different conversation with that doctor, and that doctor can then decide if those tests or those medication changes are appropriate. And then that doctor can take over the care from there and make the actual changes that might be required. Is there anything else to add there, Dr. Scheuer?
It was something I was thinking of. So yes, having the forms filled out beforehand makes it so much better for us because we have all the information, can assimilate that even before we see the patient. And I've had some people who are in a state, like I have a New York license, but I have some people who are in, say, New Jersey, who drive over the border to see me. And that happens with other docs too, but we still already have docs in every state. So that's great.
Yeah, and that's an important point. And that's a point of confusion for telemedicine in general. It doesn't matter where you live. It doesn't matter where your home is or your residence. What matters is that you are in the state where your doctor is licensed while you're receiving your medical care. So it is perfectly appropriate for someone to drive across state lines and then have an appointment with a doctor who is licensed in that state, in New York, for the example that you just shared. And then they can drive back to New Jersey exactly the same way as if someone drove into New York to see a doctor at a hospital, right? And then they would drive back home to New Jersey in that case. So it matters where the patient is licensed. But I love also that what you said, Dr. Kim, about basically the collective knowledge that I think the world of every single one of the doctors at Love.Life Telehealth, and I'm not only biased in that, but I hear from the patients when they call back or when they write in, and they're just incredibly satisfied with everyone. But knowing that you all meet twice a month to go over cases, to talk about successes, and basically to learn from each other. I mean, this body of knowledge is growing tremendously fast, having 10 physicians seeing patients and then collaborating behind the scenes. So it's really wonderful to see that. We did anticipate some of the things that people might be interested in, some of the highlights, and we're not going to go through all of these one by one because we really do want to leave time for open questions. But I just want to highlight that physicians are available to see patients in all 50 states and internationally. And what that means is that almost anyone on the planet can have an appointment at Love.Life Telehealth. So this is really appropriate for everyone. There are a couple of examples that might be in American territories where licensing would be required and we don't have a licensed doctor, but that is very, very rare. They can order the labs and tests. I mentioned that. The conversations are different. And I can share one example, and then Dr. Kim, I'll let you elaborate a little bit. But the example that I like to share to help people understand how the conversations are different is that if I go to see my regular doctor or my conventional doctor and my cholesterol is, let's say, 185, right? I'm within the normal range. So my doctor is basically not going to, have anything for me. There's no reason to go on medication at that point. But if my cholesterol has been slowly creeping up and now it's at 185, that doctor is really just waiting for it to hit a tipping point before they're going to prescribe medication. But if a doctor at Love.Life Telehealth or a lifestyle medicine doctor would see that cholesterol was creeping up and now it's getting to 185, they would also agree that it doesn't require medication, but they've got a much broader tool belt. The lifestyle medicine doctors and the doctors at Love.Life Telehealth can have a conversation and say, hey, look, your cholesterol is not in a dangerous place, but it is creeping up over time. And do you know that if we can turn this around and get this down closer to 150, that we can almost eliminate the risk of you ever having a cardiac event? And those are the kind of conversations that can help to focus on prevention rather than treatment of medical conditions.
And
Anything
I
else?
can tell you that so many times I've had people say, I have never heard this before. My doctor's never mentioned this to me before. When we're in medical school and in residency, we don't learn prevention. We don't learn lifestyle. We don't live lifestyle. I mean, same thing with cigarettes. It takes 15 years and 7,000 studies for doctors who smoked to say, wait, smoking is not good for you. And it's the same thing with food these days. I see a lot of doctors who are like, oh, my patients can't change because I can't change. Well, at Love.Life Telehealth, every single doctor you will see lives the lifestyle they prescribe for their patients. And that's a huge difference. So we understand. Plus, we've all been there before on the struggle. I don't think any one of us was born healthy in healthy families. We've all had, I mean, there's some that started younger than others, but I wasn't healthy till I was 47 and trying to prevent the breast cancer. My risk factors have gone down tremendously. So when people come and say, my doctor says this, I understand why they say that. They weren't trained to do this. And so we can explain very clearly why lifestyle medicine helps and how. And we can work on not just scaring a person into, changing, but what's your joy? What's your goals? And how do we help you do that? So those are, plus we have time, it's much better, as Anthony said, if we can have a 60-minute, especially for the first visit, but even sometimes later on, when needed, to have a 60-minute visit, because we can have the time. The full 60 minutes is concentrated on the person and not on all the technical stuff. So, that's how I find it very different than when in my traditional.
I'm really glad you explained that. Thank you. Yeah, that was important. The other thing I want to mention, I know we have a slide here. We're going to touch on pricing because it's a big question that comes up. So we made a whole slide for it because it's a little bit complicated. But before I go to that, I want to mention that we do Facebook live chats twice a month. And if you follow us on social media, just look for Love.Life Telehealth on Instagram, on YouTube, or on Facebook. And this is a way that patients can get general information. So obviously this won't be medical care, but you can get your questions asked. And I tell patients when they call and they're like, well, I don't know if the doctor will be able to help me or this and that. I'm like, look, join our next live chat, write in your question and ask. And then you'll see what the doctors can recommend for you. And sometimes they can actually recommend things that a patient might want to do. Again, it's not medical care, but they're making suggestions on things that can help in general. Or they'll say, hey, look, I'm very confident that I can help you with that. And then the patient knows that that it would be appropriate to schedule an appointment. But this is how we try to balance, because the appointments are patient pay. And I say that there is a big caveat, but what we don't want to do is overpromise. So we are trying to keep these appointments as affordable as possible. So the 30-minute appointment is $175 and the 60-minute appointment is $350. So it's the exact same rate. It's always $350 an hour. It's just whether it's a half hour or a full hour. We do accept both healthcare savings account and flexible spending accounts for appointments. And that basically allows patients to pay from their pre-tax dollars when patients have those kind of medical plans that allow them to do that. Also, we do provide super bills after the appointment. And for anyone who has private insurance, a super bill is a fancy receipt. It includes all of the doctor's provider information. It includes all of the diagnosis codes for your visit, and it includes the treatment codes. And that's all ready for you to submit to your insurance company on your own. It's very complicated for us to predict how much you may or may not be reimbursed, because it does depend on your diagnosis and it does depend on the treatment code. And most importantly, it depends on your plan. It depends on your deductible. It depends on your out-of-network benefit, but we do see a lot of patients who are fully reimbursed. But since we can't predict it, the only thing I can really say with confidence is that your first appointment is a little bit of taking a chance. You have to take a chance on that first appointment. You'll get your super bill, you'll send it in, and then you'll see what your plan covers and how that works for you. So I wish I had a different answer there, but in full transparency and honesty, that's the best I can promise for that. And finally, here's the fun part. Maybe, Dr. Kim, we can let you highlight a couple of these, because these are things that our patients have said. And some of these are in full testimonials that you can find on our website. And some of these are just, whether they're just quick emails or text messages that we received or things people have said on the phone. But this is what it's really all about.
And people worry about the cost, but then you see so many of our patients discontinuing meds. And so like I was able to discontinue my blood pressure meds. Side effects have been normal weight for the first time in 50 years. I have had people getting off insulin and blood pressure meds, cholesterol meds, and that makes it cheaper. I had another person said, I'm so glad I did this. This is the best doctor's appointment I've ever had. My husband, Tim, stopped metformin and Jardiance after 3 weeks, and lab results have our family doctor astonished and so excited. I've heard, this is how healthcare should be. I've been searching for care like this for 10 years. All of these are amazing and the results are great. We've lost over 22 pounds in 6 weeks and now are walking 5 to 10 miles with so much more energy. People, when they join Love.Life Telehealth, and even if you're not ready for an appointment, as Anthony said, we have a Facebook Live, but we have a newsletter that has really great information we send out to people. So you'll see people walking away, people with tremendous changes, and very grateful. I've had people who've lost so much weight and they've never been able to lose weight before. So please definitely stay in touch. These are the ways to do it.
We won't leave that one up too long because I see there are 12 questions already in the Q&A, and I know we have about 15 minutes left, so we do want to jump into that. But if you want to just check these out quickly, it's pretty easy to find us, Love.Life Telehealth, everywhere. Please do.
Yeah.
Now I can stop sharing and we can go to the Q&A session.
Great. So thank you so much for that amazing presentation, you guys, and the amazing work you're doing. Anthony, you reminded me, you were talking about, you went to all these conferences and you noticed a pattern, which is that there was just, the resources weren't available to the patients. So we actually that's kind of how I feel what we do at Rochester Lifestyle Medicine Institute is to kind of operationalize things. So there's one thing that I notice when we go to conferences, we always hear, wow, lifestyle medicine and plant-based nutrition is great. And they give an example of a patient and how well they did. And then I thought, the truth is there are real patients out there that have real problems. And those are the ones we ought to be talking about. So that's what we do our monthly lifestyle medicine grand rounds. And I know Kim has presented, you did present. Yep. And, it's just been a lot of fun doing that. And we try to operationalize things for doctors anywhere in the country who want to have, put their patients through our Jumpstart or anything else, or CHIP or our LIFT programs. I know you guys have been referring to that. So go ahead.
Yeah, if I can just support that. And it's another thing that's so beautiful about this community is that we are all in this together and that everyone's 100% focused on the patients. And thank you for mentioning that. We love partnering with you in your Jumpstart program. And I know we have that information right in our library for patients. So basically it's another tool on the doctor's toolkits. And I know they recommend patients to participate in your Jumpstarts all the time because they're under supervision for the doctor, but we collaborate with a team like you who's wonderful at helping people to have all the information that they need to be able to get this going and actually get it put into the real world. And we're not using basically doctor appointment time to do those things. And then added benefits of you having the community involvement and the cohort of people going through a Jumpstart together. It's just, it's phenomenal. It's wonderful to collaborate with everyone else.
Well, I like you're doing that. That's good.
We're all in it together, right?
And
and everyone has a story, and everyone's here on purpose, and everyone's here to help. And it's just it's incredible. I know we talked all about Love.Life Telehealth because that's where we're coming from, but it's everyone who's practicing lifestyle medicine. I would say the exact same things about.
And I can tell you from my own personal experience, I've sent patients to the Jumpstart, and it's changed their lives, which makes my life easier in helping them.
Sure. And we have participants from all over the country, and they'll say, who can I see? I don't have a doctor locally who understands me. We say, well, you got Love.Life Telehealth.
There we are.
Yeah, exactly. So I'd like to just introduce Jared. He's our medical student from the University of Rochester, and he's going to be helping field the questions. So Jared, what kind of Where should we start?
Okay, 13 questions. The first one was, do you have screening questions or a template that you use for your telehealth sessions?
So I'm trying to figure out what they mean by screening questions. So each of we have the forms that you fill out beforehand. Then you come to see me, and it's just like a regular visit. With a new patient, I will say, you know, I know you have questions for me. I have a bunch of questions for you. Thank you for sending me all the information, because that's really helped me focus where I need to go. And I start asking questions like, I'll clarify some questions about meds or whatever, or lifestyle, or how'd you get into, what have you tried in the past to lose weight, or what have you tried before? What are the side effects that you're seeing? And so we have the paperwork that's screening, but then each doctor has their way of talking to the patients, and it's not set, it's very individualized. I change my approach for each patient based on what they need. Does that make sense?
Yeah.
Yeah. We had another question come in, which was around curbside consults. So if a physician has a question around consulting around a lifestyle medicine question, is there a way for them to get in contact with you guys?
They can contact me through Love.Life anytime, because I love to help others help. If it's a curbside, that's easy. If it's not, and they need more help with their patients, I can do a official consult where I see the patient for maybe 30 minutes and send them back to you. We do a lot of work directly with patients, other physicians, because I have some very complicated patients where, for example, if they're on dialysis or they have cancer and undergoing chemo or radiation, I want to have communication directly with the other docs. So I don't want to go against other doctors, but there's some things that I can do to help other doctors help their patients get healthier faster.
What about doctors who want to sign up with you? We got some, at least one person in the audience who wants to become one of your doctors.
Well, I scanned the Q&A and I saw a couple of doctors, and I saw a couple of other types of providers. It looks like there are a couple of providers. So I want to be truthful, as much as I wish we had a different answer today. You know, the Love.Life Telehealth is growing in stages. So first we had a couple of providers, and then we brought on some patients, and then we brought on some more providers, and then we can bring on more patients, and then we can bring on more providers and more patients. So it's going to grow like in steps like that, progressing over time. And right now we're in a cycle where what we really need are patients, you know, quite frankly. So we can't really bring on new providers until we get more patients. So except the difference may be some very select specialist, or if we have a state where we only have one doctor that happens to be busy, then we will want to add that. So it's complicated to grow nationally, but we cannot wait for the time when we are ready to bring on many more providers, and that will include physicians. And then the other question that came up, it will then include other types of medical providers as well, and healthcare providers as well. And we've talked about everything from having physician assistants, to having nurse practitioners, to having health coaches, and we can have a tier. Right now, how we're facilitating those things is by collaborating with you know, organizations like the Rochester Lifestyle Medicine Institute. You guys are wonderful doing what you do. The doctors at Telehealth are wonderful at what they do, and it works together. And eventually, just as we all kind of rise this tide and all of our boats are floating up, then I just think that there'll be opportunities for everyone everywhere. But the short answer is, if you are interested, please email us. It's telehealth@love.life, or my email address is anthony.masiello. That's a mouthful. It's probably better to email telehealth@love.life, and just send your name, and I'm happy to have a conversation to be a little more specific on what it might mean for the person, whether they're a physician or specialist or another kind of provider. And we can talk about it and see when there might be appropriate time to collaborate in the future.
Right. Jared, what else do we have?
As you said, we had a lot of questions about people who wanted to get involved. One question that I had was around the challenges that arise in this sort of model, kind of compared to the traditional inpatient, in-office model. In what ways does it work better? In what ways do you kind of wish there was something you could change about it?
Well, I can start on the medical aspect and then Anthony can start on the other. So the great part is I can reach people all over the country. I love that. And I have people in rural Kentucky, in Kansas or different places I would never go to. Challenges are I can't do a pap smear. It's harder for me to see if they have a skin lesion in lighting. I can't hug my patients. I miss hugging my patients. Those are the challenges for me, but on the plus side, I absolutely love what I do. I love the time I have with my patients, and I love being able to consult with the other doctors at Love.Life Telehealth, because that is just phenomenal. We have such a great group. So that's how I see it.
One of the challenges that I work with often is, not everyone is on the same kind of level kind of on the tech savvy scale. And it's hard sometimes to help someone to upload lab results that they have in another portal. We're working on all of these things. We're working on streamlining the experience for the patient, both the time with the physician and also preparing for the appointment. But we spend a lot of time helping patients to make sure that they get their labs in ahead of time, and that they make sure that, and I tell everyone, if you have lab work that's less than 12 months old, let's get it in here, because it's only going to add to the conversation. But some people have challenges doing that. I'm going to knock on wood that our video system has been very reliable. Our patient portal has been very reliable. Like all medical systems, they're not up to par with the social media systems and like the Gmail and the Google systems that we all get to use in our personal lives. But that's because there are clients, and there are compliance and there are regulatory things and HIPAA. Patients tell me all the time, you send me an email that says I have a message. Why can't you just send me the message? But it's because we can't pass a message from a doctor about a patient's medical condition through the email system. So you get a little alert that says, hey, you have a message in your portal, and then patients have to go and log into the portal to read it. So there are all of those kind of normal things, and I think the systems will get better over time. And of course, we're looking to accelerate that as much as possible.
What else, Jared?
We had a question from Manisha, which was more around what sort of changes are recommended in a lifestyle medicine program. So the specific things that she asked about were things like lifestyle changes, supplements, exercise, as well as diet.
Okay. So we definitely talk about all of that. There's 6 pillars of lifestyle medicine. However, Rochester Lifestyle Medicine Institute has added some more. So you can look at that on either their website or ours. They're perfect. But basically, we go through a whole bunch of things, and it's, again, individualized for what the patient needs. We discuss medications, and if you change to a certain lifestyle, for example, if you're eating an unhealthy diet, and then all of a sudden do the jump start or change your diet over to a healthy one, and you're on medicines for diabetes or medicines for blood pressure, you need to have a physician available to rapidly de-prescribe medications, which is what I love to do, because if you don't, you're going to have side effects from dropping your blood pressure too low or your sugar too low, and that's not healthy either. So it's food. We talk about food. We talk about movement and exercise, which is very important. We talk about psychiatric, getting outside into the sun and getting into nature and de-stressing, and not just de-stressing, but how do you deal with the stress that you have to deal with? There's normal stress in life. So how you deal with that, and to be able to deal with stress better. We talk about community and how do you get involved with your community again and have a sense of purpose in life. So it depends on where the patient is. That's where the very complete paperwork beforehand helps me have a starting point and things that I can look at. Like, even, are you brushing your teeth? if you're not brushing your teeth every day, you're increasing the bacteria in your mouth, which is, can cause issues with your heart. And people don't know some of these things. So we talk about everything, from every aspect of it. What's important to you? What makes you happy? What's your reason for living? Why do you want, as Anthony said, he wanted to do this to be able to be there for his children. That's a very motivating thing. And so we talk about all of those aspects. And again, it's very individualized for each person.
Dr. Scheuer, how do you manage, this isn't on the Q&A, but I'm just curious, how do you actually manage people's medications? So if people's blood pressure, because if you don't have an appointment for a couple of weeks with you and their blood pressure is starting to come way down, what do? They call you or what happens?
So there's a couple of different ways. We use some technology also, like we'll use a continuous glucose monitor. So I can actually monitor what's happening with their sugars. Through the portal, we can email back and forth. And so for somebody who I'm worried about their blood pressure, I give them parameters to contact me.
Mm-hmm.
And they can contact me, and within 24 hours, I will contact them back. But, also I'm very clear, if you're having an emergency, I'm not there. You need to go to the emergency room or something like that, I'm not physically in the same place. But I can, like I have one patient who's on the continuous glucose monitor, but more than one patient, puts their blood pressures on there. And so I can see how their blood pressures are trending. And then I can contact them in between. If I'm worried about somebody, I'll put a reminder to myself to contact them. So honestly, they're getting a lot from our doctors. It's not just the 30 minutes. It's the 30 minutes together, but we put a lot of work in before and after as we're working with patients. So I can help out. There's some people that have local, like some people with congestive heart failure, or they have a local cardiologist too, that they can work back and forth with me helping out as needed too. So there's a lot of different ways to do that.
Great. Jared, I think we have time for one more question. Then we're going to officially come to an end. We might go into the lobby here. Let's see.
Yep, there was a question from Carol Barnett about the impact of COVID-19 on the trajectory of telehealth.
Can I start?
Absolutely.
Go for it.
So when we started plant-based telehealth, just with COVID, before we even really knew what COVID was going to be in March of 2020, we thought we had two obstacles that we needed to help patients to understand. The first was that lifestyle medicine is real licensed medical care, evidence-based, and all of that. We know we still need to educate the public on that one. The second was we thought we had to educate people that telemedicine was a real way to deliver medical care. And that one got completely erased through the COVID because every single doctor started doing some form of telehealth. So that has helped. That has actually helped us. I don't think COVID was good for very much, but it was one thing that it did was it really opened the door for telehealth and legitimized it and helped us to be able to reach more patients.
Great. I'm going to just put up one of our slides, and we're going to officially dismiss people here. But I just want to let people know this is just to let you know about the programs that we have coming up. If you're interested in any of these programs for yourself, your patients, or your families or family or friends, all three of these programs are certified by the American College of Lifestyle Medicine. And we run the Jumpstart program every month. We've had 1,800 people go through it now from 44 states and I think 9 countries now, just getting amazing results. That's a very intense program. It's only basically 2 weeks. So we also run the Lift Project for people who want to stay on the path and maybe not ready to go into Jumpstart. They just want to, they're not in the best place in the world. So it helps to elevate their mood. And then the Complete Health Improvement Program, which is now known as PIVIO, we also run that on a regular basis. We're one of the largest providers of the PIVIO program as well. And of course, you can always follow us on social media. We're known as Love.Life Med. So please follow us there. And again, those are our programs. And I'm going to stop sharing that. And
well,
we're going to, sure.
I have taken every single one of those programs. They're fantastic. You guys are
okay.
So well.
Thanks. Yeah. I mean, as far as I know, we're the only organization that runs all three of these on Zoom and basically for anybody anywhere in the country or world, actually. And what's kind of cool, if you happen to be a medical practitioner and you sign up for the LIFT project or the Jumpstart program, you can receive 10 CMEs, and we have special pricing for that. It's free, actually, because we have a very generous donor who wants to reach as many medical professionals as possible. So if you're interested in that, just reach out to info@rocklifemed.org and we can get back to you about that. So this is the official end of the program. We still have about 70 people on, and if there's any more questions, go ahead and go ahead, Anthony.
Can I answer what's honestly my least favorite question of all? And it's my least
Sure.
favorite because we don't have a good answer, but I did see that it popped up in the Q&A. There was a question on if the doctor's services are covered by Medicare. And there was another question on if we're working with any of the large insurance providers to get these cares covered. And they're really important questions, so I don't want to let them go unanswered, but the truth is we don't have a great answer. So the Medicare answer right now is the most straightforward. Unfortunately, the way that the system works right now, if you're a Medicare recipient, which means you're just enrolled in Medicare, then it's 100% patient pay to see one of the doctors at Love.Life Telehealth, and there's no way that you can be reimbursed. So it pains me to say it like that, but that's the best that we can do at the moment. We will work to try to get that changed, but quite frankly, we're years away from being able to do anything there. As far as working with larger insurance companies, there will be opportunities to do that in the future. What we really need is to collect data and information so that we can share the outcomes with them, to help the insurance companies to understand that a 30-minute or a 60-minute appointment should be reimbursed from the start. Because the way the insurance reimbursement works is it depends on how many diagnoses the doctor can document and all of these other complicated things, which means that we won't know whether the appointment is being reimbursed for a very low amount of $20 or $30, or if it's going to be reimbursed at the full amount of $350 going in. So we unfortunately haven't been able to start that, but we're pretty confident, and it's a core part of our mission that we want to be able to influence these insurance companies to get this care covered. And as soon as we show them the outcomes on the scale, that we think that we will be able to help to influence them to do exactly that. So I wish I had better answers, but I do want to answer those as clear as possible because we want to, of course, be fair. I think we want this to be the most honest transaction that there is in healthcare at all. Even if it means that patients have to pay, we want it to be as open and honest as possible.
And that's a great answer, Anthony. It's really a challenge getting the healthcare system to change. One of my colleagues says that every system is perfectly designed to get the results that it gets. And that's what we have. We have a system that's perfectly designed to get the results it gets, and it's really hard to change it. So we've all been poking at this from different directions for a long time, and slowly it's moving, I think, but it's going to take quite a while. So maybe in Jared's lifetime, his career period. Yeah. Anyway, Jared, anything else you think we ought to cover before we call it a night?
I think that was most of the chat.
Great. Well, listen, Anthony and Dr. Kim, thank you so much. We really appreciate all the work that you're doing. And Jared, thank you for helping out. Good luck in medical school. You're going after your residency soon, I think, this summer, right?
Yeah.
What residency are you going to?
Ophthalmology.
Ophthalmology. Okay. Excellent. All right. We could always use this. Actually, we're working with an ophthalmologist out in Walla Walla, Washington, his practice is called the Lifestyle Eye Care Center.
Wow.
And so very exciting. Anyway, thank you all very much. Keep an eye out at our schedule for upcoming events. We have Dr. Joel Furman next month. If you're a medical professional, keep your eye out for our lifestyle medicine grand rounds. We love having people for that. So take care, everybody, and thanks again. Bye.
Thank you for having us. Thanks everyone for joining.
Pleasure. Good night.